Hey everybody, welcome to Baltimore Sports Clinic. Today we are going to do what's called a reverse Nordic exercise. A traditional Nordic exercise, you can look it up on the internet, works on your hamstrings and your posterior chain in controlling that. This is the opposite of reverse Nordic, which will work on activation, strengthening, mobility of the front chain, your anterior chain, or your sling. It's going to work on your quads, your rectus femoris, your hip flexors, preventing you from going into extension. So that's what they're meant to do, is to control that stuff. You might try this exercise or mobility drill if you have knee pain, if you have hip pain, maybe some low back pain where I lean backwards and I feel a pinch in my back. Maybe you try 10 or 15 reps of these and then retest and see, does that make me feel better? Can I squat better? Do I not feel a pinch? So we'll give you a couple variations based on restrictions you might have. When you go down, I would encourage you to use a knee pad. And you might have some toe limitations, so just be respectful. You might point your toes down. If you can, I would encourage you to put your toes down on the ground. And from here, you're going to get tall. And the exercise is very simple. You're going to lean backwards until you feel tension in the front part of your body. Be respectful of that barrier. And when you start to feel it, just hang out there and come back up. Each time, maybe you go back a little further. If you want to enhance this a little bit, imagine your pelvis as a bowl. You're going to tuck your tailbone underneath and rock it backwards before you start. That'll create a little bit of pre-tension right here, and then lean backwards, and it might limit that range. A variation or assistance, if you feel like you can't control that, is put something here to give you some assistance when you go backwards. But I would try that 10 or 15 times. That is called a reverse Nordic. Let us know if you have any questions. Until next time.